There are many ways you can be accused of healthcare fraud by the federal government. One of the ways is overbilling for services that are rendered to Medicare, Medicaid, TRICARE, or private insurance companies. Another way would be receiving a kickback or some sort of bribe in exchange for referring people to a federal healthcare program. In addition, you can also commit healthcare fraud by performing medically unnecessary services that shouldn't have been performed in the first place. CMS guidelines, which are used to determine whether or not healthcare fraud was committed, hundreds of thousands of pages, and it's nearly impossible for a physician to comply with every single one of them. So what happens if you've been billing a certain way and you realize that it might have been a mistake, or you're performing a service in a way that might be in violation of guidelines? Now, if it's too late and you're already facing government scrutiny for healthcare fraud, there are certain things that you can do in order to minimize the risk to your practice and keep yourself out of jail. Our healthcare fraud team will show up, interview everybody at the practice, develop as much good evidence as possible, and defend the decision making at your practice before the government even engages in scrutiny.